Hello, I'm Ellen Horan, President and CEO of the Greater Reading Chamber of Commerce and Industry, and I'm here for this week's Member Spotlight with Dr. Michael Balthaser from Dental Arts of Wyomissing. Welcome, Dr. Balthaser.
Thank you for having me.
Great. So you have a practice on Berkshire Boulevard in Wyomissing, and I understand you have your business here because you're really a Berks County product.
Yeah, I am. I grew up in Burnville, Pennsylvania, and I decided to come back to the Wyomissing area. I originally opened up my practice in 2006, originally on State Hill Road, and we moved over to Berkshire Boulevard back in 2010, and we've been at that same location since that time.
Great. So tell me about the range of your practice. Full service?
Full service ranges from all ages, from infants to people in their 90s. We treat a whole host of dental issues, and we are comfortable treating. We perform many specialty services, even right in our office, including sedation as well as root canal procedures, extractions, and implants.
Okay. Talk to us about what are some of the trends in dental care. As someone that has been fortunate, I've only need to go for my every 6 months cleaning, which I do. What are some of the trends of what the consumer's looking for in dental care these days?
Well, I'd say in the past couple years, there's been a big trend towards insurance-based practices. People are very aware of what their insurances cover. They're also concerned about what their insurances don't cover. And I think one thing that sets our office apart is we go above and beyond to accommodate the patient and let them understand their insurances. I feel a lot of patients come to the practice either frustrated with a previous experience at the dentist, scared of other experiences at the dentist, and the last thing they need is to not know what the financial obligations are going to be for them. So that plays a big role, especially I would say in the past 3 or 4 years in my practice, as far as how we help feel the patient at ease as far as what is covered and how we can go about getting them coverages for the procedures they need. Right.
Shall I read into that cosmetic dentistry is kind of slow growth?
Well, if you... It depends. Obviously, if you're good at what you do, the cosmetics kind of go hand in hand. I would say someone who's promoting themselves as just a strictly cosmetic dentist would be a slow growth process because those typically are 100% elective procedures. Not to say that we don't do those procedures. We certainly do. We do a lot of them. But I would just say as far as the majority of the consumer out there that's not the first thing on their list. And to be honest with you, a new patient that comes to my office, they may think a cosmetic thing is the number one priority on their list, but then if they haven't been to the dentist for 5 or 10 years and they have a whole host of other issues, before we can treat those cosmetic issues, we have to really address the first couple problems.
Right. Now, I remember a few years ago, the Berks County Community Foundation had done a study on medical care available in Greater Reading, but I think it focused a lot on the city of Reading. And they were surprised that the results of the survey turned up that where there was a real gap in service was actually in dentistry.
Yes.
That minority populations in particular were not availing themselves of dental services. Is that something you've found?
I would say yes, to an extent. One of the things that I've found helpful is a language barrier is definitely an issue in Berks County, particularly in the Spanish-speaking populations. I can't say that I myself am bilingual, but we certainly do see a lot of patients who English is not their first language. And I do have a comfort level in getting through dental appointments with those individuals. We do have translation companies available via cellular technology, as well as, like I said, myself have been able to treat the patients that English might not be their primary language.
Right. Now, you're pretty young. I see this 40 under 40. Kudos for the recognition there. Is that unusual for a young dentist to be able to start their own practice? Is it more common to go into a practice, or what caused you to?
Actually, I did. I bought my initial practice from a retiring dentist back in 2005. It was a much smaller practice than what it is now. So starting out from scratch, I would say, is very difficult for a dentist, especially nowadays coming out of dental school with hundreds of thousands of dollars worth of debt. I employ an associate dentist at my office as well, and it's difficult for a younger dentist to come out. I was just fortunate with the opportunity I had that opportunity became available in Berks County. I knew what I wanted. I'm a very goal-oriented individual, so I kind of jumped on board and took a chance and took a risk.
Congrats to you for being able to do that. It reminds me of so many chamber members, though, that are focused on their craft. They start a business or they purchase a business because they have a passion for what they do. But then they have to learn to balance, how do I run the business end of that? Is that something that you have found as well?
And I would say that's not something that they teach in school.
Right.
That's kind of learned hands-on.
Right.
It's also, in my position, being, the primary service provider for, my business, it's important to have employees that can help you manage, particularly in my situation, insurances, for example. It's not like I can spend the time on the phone with insurance companies or asking questions regarding coverages, things like that. You need to employ a staff and a team that can do that for you.
Right. And how about, I would assume the same for marketing and or handling the financial end outside of insurance, just your bookkeeping and all of that?
Surprisingly, I do a lot of that myself. I'm slowly trying to push things away and spend more time focusing on the actual services rendered. It's a hard thing to do, I think, as a business owner.
It is.
But I'd say I have my hand in that a fair amount.
Good. Very good. Well, before we wrap up, is there any tip you would like to give chamber members? How about, first of all, regarding dental care? And then secondly, we'll get to see if there's a business resource tip. But dental care-wise, tip for chamber members?
I would say to, number one, to visit your dentist on a regular basis to help prevent dental disease. Number two, get your children involved visiting the dentist at a very young age. The current recommendations for the American Academy of Pediatric Dentistry is to have the child seen within 6 months of the eruption of the first tooth. Wow. The eruption of the first tooth happens at 6 months of age. So we do see a lot of dental disease in the young children. I've unfortunately, had several 3-year-olds in my chair this month alone.
Wow.
So it does happen, and it's not necessarily any parent's fault, but I would get them checked early, especially with the sodas, the fruit juices, the gummy, candies that are out there. If left undetected, it can really wreak havoc on a young child's mouth.
Good point. I think I didn't get that good mothering tip. I don't think I took them that young.
That's actually a new recommendation.
Oh, okay.
Years ago, it was age 3 or 4.
Yeah, all right. I'm good then. Very good. And how about a business resource tip? Is there anything that you have found particularly helpful?
I think online marketing is essential for businesses nowadays.
Meaning having a social media presence and
social. Yes, do we have social media? Yes, is that a huge thing for my office? I would say no. I would just say have an internet presence.
Got it.
People have, as you and I both probably have their phones in our pockets, checking the weather out there or what have you. And if someone's looking for a certain type of service or business, that's the first place they're going to go. So I think having that presence is almost essential. And then also, obviously joining the chamber is a good thing to do as well.
And you know what? We're just launching a mobile app. So you'll have to take a look and make sure you're connected with that. So very good. Thank you very much for coming today and sharing some information about your business. And thank you for being a chamber member.
Thanks for having me.